It can begin suddenly. Breathing becomes harder, your chest tightens, and you can't seem to get enough air. Then you may hear a wheeze as air struggles to move normally through your lungs. Your chest may feel tight, making each breath feel smaller and more difficult than the last. But what's actually causing these symptoms? To find out, we need to go inside the respiratory system. Asthma is a long-term condition that makes the airways unusually sensitive and prone to inflammation and narrowing. In asthma, the airways can be unusually sensitive, reacting strongly to things that normally wouldn't cause a problem. For some people, inherited traits can increase their likelihood of developing asthma. But genes aren't the whole story. The environment can also influence who develops asthma. Triggers vary from person to person, but they can all provoke the same sensitive airways. When a trigger reaches a sensitive airway, the body can respond with an exaggerated inflammatory reaction. The airway lining starts to swell, making the passage narrower and more sensitive. Around the airway, smooth muscles contract, squeezing the passage even tighter. At the same time, the airways may produce extra mucus, adding another barrier to airflow. Swelling, muscle tightening, and excess mucus now combine to restrict the flow of air. Now the problem becomes obvious. Air can still move, but it has far less room to get through. With narrowed airways, pushing air out of the lungs can become especially difficult. Because some air can't escape easily, more of it can remain trapped inside the lungs. As airflow becomes restricted, the muscles responsible for breathing have to work harder. That increased effort is why an asthma attack can make you feel like you simply can't get enough air. With severe narrowing, less fresh air reaches the deepest parts of the lungs, where oxygen exchange happens. That narrowed passage makes airflow turbulent, creating the familiar whistling sound called wheezing. Irritated airways and excess mucus can also trigger the body's cough reflex. Inflamed, narrowed airways and increased breathing effort can create the uncomfortable feeling of chest tightness. As breathing becomes harder, the body responds by increasing the effort and speed of breathing. If the narrowing becomes severe, breathing can become dangerously difficult and requires urgent medical attention. Deep inside the lungs, oxygen must reach tiny air sacs called alveoli before it can enter your blood. Across the delicate alveolar walls, oxygen moves from the air into tiny blood vessels surrounding each air sac. During a severe attack, restricted airflow can reduce the fresh air reaching some of these air sacs. Once oxygen enters the blood, red blood cells carry it away from the lungs to tissues throughout the body. When breathing becomes severely impaired, the body may struggle to maintain adequate oxygen delivery, making the situation an emergency. As the attack worsens, breathing can require much more effort, leaving the person exhausted. The harder the body works to breathe, the more important effective oxygen delivery becomes. Severe difficulty breathing, worsening symptoms, or trouble speaking normally can signal a medical emergency. In a severe attack, healthcare professionals can provide urgent treatment to help restore effective breathing. As effective treatment begins working, the goal is simple: restore airflow and make breathing easier. Quick relief medicines can rapidly relax tightened airway muscles, helping air move more freely. As the airways open, airflow becomes smoother and more effective. With better airflow, more fresh air can reach the alveoli, supporting more effective oxygen exchange. As airflow improves, the breathing muscles can work less, and each breath becomes easier. Feeling better doesn't mean asthma has disappeared. Symptoms can return when another trigger affects the airways. For ongoing asthma control, doctors may prescribe medicines that help reduce airway inflammation and prevent symptoms. Learning which triggers affect you can help you avoid them and reduce the chance of another attack. Asthma becomes easier to understand when you see the chain: trigger, inflammation, narrowing, symptoms, and recovery. Asthma isn't simply trouble breathing. It's a complex airway reaction, and understanding it can help you recognize and manage it.